Hello everyone, I am Sanjana, Onco nutritionist from ZenOnco.in. Today we shall be speaking about a common consequence of the treatment which we come across amongst the cancer patients, which is constipation. It is very important to understand what is meant by constipation. So, constipation is basically defined as the slow movement of the feces through the large intestine, and this will result in an infrequent bowel movements and the passage of the hard and the dry stools as well. Constipation is a common sign or symptom which is seen amongst the cancer patients, and it can occur due to various reasons such as reduced intake of fiber or because of dehydration or because of the various chemotherapy drugs which they take. So let us also try and understand some of the common chemotherapeutic drugs which can have an impact on the bowel movements and can also cause constipation issues. So one is vincristine and some opioid pain medications. Now, what happens is that in the cancer patients, we see that most of them experience a lot of pain, right? So that pain has to be reduced. There is also certain amount of inflammation which is there in the body because they are experiencing pain. Most of the pain medications which are given are opioids, and they are given only under the prescription of a doctor once they will assess their pain. Pain management is also important in the patients because it will also cause the body to undergo a lot of stress and trauma. Also, in the cancer patients, when they undergo various treatments, it could be either a chemotherapy or it could be radiation or even a surgery. So, what happens is that it is going to cause reduced iron levels in the body. A patient either can have anemia at the beginning of the treatment or even before prior to the treatment. So it is very important to also take the lab parameters to understand what are their hemoglobin levels. Taking prolonged iron supplements can also put a patient at a risk of developing constipation as well. Now let us try and understand how and what intervention can be done to manage the constipation issues in the cancer patients. First of all, hydration is the key. Hydration is extremely important so that it is going to keep the body well hydrated and prevent from getting dehydrated. Fluid intake is recommended to prevent dehydration related constipation. Not only this, also water is absorbed in the body when we have an intake of insoluble fiber. This what property of insoluble fiber is that it is going to absorb the water and it is going to bulk the stools, and due to which this is going to prevent constipation. In my earlier videos I had also spoken about the importance of insoluble fiber in reducing constipation issues. Fluid intake of 2 to 3 liters is recommended. However, if a patient is a renal patient or if they are having any cardiac comorbidities, then depending upon the fluid restriction which has been given by the doctor, then yes, the diet and the fluid intake has to be taken into consideration and then the diet has to be planned. Next is dietary fiber. As discussed in the earlier, insoluble fiber plays a very important role in promoting the regular bowel movements. So you can surely include complex carbohydrates like millets or brown rice, fruits and vegetables which have a good fiber intake in them. Even prune juice has been shown to reduce the constipation issues. In your daily diet, you can also incorporate overnight soaked black raisins. Even these have been shown to be beneficial not only in promoting good, better digestion but also it has been shown to have a positive impact on the overall gut health as well. Is physical activity. So, yes, for the cancer patients who undergo various treatments, they do experience a lot of weakness and fatigue, due to which this is going to also have an impact on their mobility as well. However, it is recommended and encouraged to at least engage in light physical activity daily, of at least to start with for 15 to 20 minutes, so that it will also help in maintaining the bowel regularity. To conclude, yes, it is very important to manage constipation issues in cancer patients. What we can do is we can encourage a patient to include a good fiber intake in their diet. Maintaining hydration is also very important, and understanding during the treatment what medications are going to cause constipation is important to know from your doctor as well. Thank you for watching my video. We at ZenOnco.io are always by your side in navigating you through your cancer care journey. For further assistance, you can always reach out to our cancer care coaches on the below mentioned contact number. Thank you.